It's sweet. It's seductive. Is it deadly?
New warnings from serious people.
The more I learn about it, the more it scares me.
Sugar is everywhere. It's in our drinks, our snacks, even in foods you'd never expect. But what if we told you that this sweet ingredient is hiding dark secrets? In this video, we uncover the truth about sugar, its harmful effects, what the industry doesn't want you to know, and how it's silently harming our health. The secrets of sugar, what you need to know. The harmful effects of sugar. What the sugar industry has been hiding. Sugar addiction, the sweet trap. Why sugar is called white death. Sugar consumption varies widely around the world, with some countries consuming more than double the recommended daily amount. In the United States, the average person consumes about 57 pounds of added sugar per year. In contrast, in countries like India, sugar consumption is lower, but still rising as Western diets become more prevalent. In Brazil, sugar consumption per capita is approximately 51 kilograms per year, among the highest in the world. Even if you're not spooning sugar into your coffee, you might still be consuming more than you think. Processed foods often contain hidden sugars, listed under names like high fructose corn syrup, sucrose, and glucose. These hidden sugars can account for a significant portion of our daily intake. Up to 74% of packaged foods in supermarkets contain added sugar. The harmful effects of sugar, the numbers don't lie. In fact, studies show that people who consume sugary drinks regularly have a 60% increased risk of obesity. Excessive sugar consumption is directly linked to obesity and weight gain. The average American consumes over 17 teaspoons of sugar per day, far above the recommended limit. This excess leads to fat accumulation, especially visceral fat, which is the most dangerous type of fat. The global obesity rate has nearly tripled since 1975, with sugar consumption playing a significant role. As of 2021, over 422 million people worldwide have diabetes, with type 2 diabetes accounting for about 90 to 95% of all cases. This rise is strongly linked to increasing sugar consumption. A study published in JAMA Internal Medicine found that for every 150 calories of sugar consumed per person per day, the risk of developing type 2 diabetes increases by 1.1%. Sugar wreaks havoc on our insulin levels. When we consume sugar, our bodies produce insulin to help absorb the glucose. Over time, excessive sugar intake can lead to insulin resistance, a precursor to type 2 diabetes. It's estimated that more than 422 million people worldwide are living with diabetes, a number that continues to rise as sugar consumption increases. In the US, nearly 10% of the population has diabetes, a condition closely linked to sugar consumption. Sugar doesn't just affect our waistlines, it also has severe impacts on our internal organs. High sugar diets are linked to heart disease, the leading cause of death worldwide. Moreover, excess sugar can lead to non-alcoholic fatty liver disease, a condition affecting about 25% of the global population. Consuming too much added sugar increases the risk of dying from heart disease by nearly 30%, according to a study published in JAMA, the Journal of the American Medical Association. High sugar intake has been associated with higher levels of LDL bad cholesterol and triglycerides, both of which are risk factors for heart disease. Section 2. What the sugar industry has been hiding. For decades, the sugar industry has engaged in tactics similar to those used by the tobacco industry to downplay the health risks associated with their products. In the 1960s, for example, the Sugar Research Foundation funded research that downplayed the link between sugar and heart disease, instead shifting the blame to dietary fats. This strategic manipulation of scientific research delayed the recognition of sugar as a major health threat and contributed to the ongoing public misconception that sugar, when consumed in moderation, is harmless. Even today, the sugar industry continues to influence dietary guidelines and policies. Through extensive lobbying efforts, the industry has managed to resist regulations that would limit sugar consumption, such as sugar taxes or stricter labeling requirements. This has allowed the continued proliferation of sugar in the food supply, particularly in processed foods that are consumed by millions of people every day. The result is a population that is often unaware of the amount of sugar they are consuming and the risks associated with it. In 2016, the sugar industry spent over $30 million on lobbying efforts in the US, alone. Beyond research and policy, the sugar industry has heavily invested in advertising targeting vulnerable populations like children. Sugary cereals, drinks, and snacks are often marketed as fun and healthy, despite their detrimental effects. Children are exposed to over 10,000 food advertisements annually, with the majority promoting sugary products. Section 4: Sugar Addiction, the Sweet Trap. One of the reasons sugar is so dangerous is its addictive nature. Sugar can be as addictive as drugs. When we consume sugar, it triggers the release of dopamine, the feel-good neurotransmitter, in our brain. This creates a cycle of craving and consumption, making it hard to cut back. This can lead to cravings and binge-eating behaviors, creating a vicious cycle of consumption that is difficult to break. The concept of sugar addiction is not just theoretical, it has been observed in numerous studies where participants show withdrawal symptoms when deprived of sugar, similar to those experienced by drug addicts. The addictive properties of sugar are compounded by the fact that it is often hidden in foods where we might not expect it. From breads and sauces to seemingly healthy snacks and beverages, added sugars are prevalent. This means that people can easily consume large amounts of sugar without even realizing it, making it even harder to avoid or reduce intake. The food industry has capitalized on this addiction by producing highly palatable, sugar-laden products that are difficult to resist, further entrenching sugar's place in our diets. When we try to cut back on sugar, our bodies can go through withdrawal, experiencing symptoms like headaches, mood swings, and fatigue. This withdrawal makes it difficult for many to reduce their sugar intake, even when they know it's harmful. Around 75% of people who try to cut back on sugar report experiencing withdrawal symptoms. Frequent consumption of sugar can lead to behavioral changes, including impulsivity and poor self-control, often seen in sugar addiction. Section 5: White Death, the hidden killer in our diets. There is a more ominous term that health experts and critics have coined for sugar white death. This stark phrase encapsulates the lethal effects of sugar on the human body and society at large. Sugar is not just a source of empty calories, it is a substance that, when consumed in excess, can lead to a cascade of health problems. The most obvious of these is obesity. The global rise in obesity rates, particularly in countries with high sugar consumption, is directly linked to the pervasive presence of sugar in the diet. The World Health Organization, who reports that worldwide obesity has nearly tripled since 1975, and sugar-laden foods and beverages are significant contributors to this trend. Obesity itself is a gateway to a host of other serious health conditions, including type 2 diabetes, cardiovascular disease, and certain cancers, all of which are often fatal. From heart disease to cancer, sugar's role in chronic diseases is well documented. It fuels inflammation, contributes to obesity, and creates conditions where diseases can thrive. Consuming high amounts of sugar is linked to a 38% increased risk of dying from cardiovascular disease. The long-term impact of sugar on our health is undeniable. From contributing to obesity and diabetes to increasing the risk of heart disease and cancer, sugar is a silent killer in our diets. Reducing sugar intake can significantly lower the risk of chronic diseases and improve overall health. Cutting back on sugar can be challenging, but it's crucial for your health. Start by reading labels, avoiding sugary drinks, and choosing whole foods over processed options. Your body will thank you in the long run. Swap sugary snacks for fruits, nuts, and other natural options to reduce your sugar intake gradually. Sugar may be sweet, but the bitter truth is that it's causing more harm than good. By understanding its dangers and taking steps to reduce your intake, you can protect your health and live a longer, healthier life. Thank you for watching. If you found this video informative, don't forget to like, share, and subscribe for more content on how to live a healthier life. Leave your thoughts in the comments below. What's the most surprising thing you've learned about sugar today?